Okay.
Hi, everyone. We are so lucky to have one of my patients here with me today, comfortable sharing her story so that more people can learn what it's like to go through the process with naturopathic medicine. Thank you so much for being open with sharing your case and your care.
Yes, I'm excited. And so my name is Tiffany, and I'm a licensed esthetician for about 2 years now. And I got into esthetician work because I was dealing with skin problems myself for like since high school. So I've been through a lot of treatments, a lot of, you know, products that never really worked for me. And I finally reached out to Dr. Soni, and it definitely changed my life for sure. And she also helped me in other aspects as well. So I'm really excited to share my journey here with her. And yeah, yes.
And shout out to you for being a small business owner yourself. Can you talk more about your practice?
Yeah, so I focus a lot on facials, a lot of acne clients. And then I always want to tell my clients, it's more than just products. It's also what we do on the inside and what we feed our skin, because our skin is our largest organ and we have to really nourish it.
Yeah, that's a really important point. So the skin is one of our biggest detox organs. We get rid of toxins through our liver, through our kidneys, but also through sweat on the skin. And
Yeah.
oftentimes when our detox pathways need help, we see things come out on the skin like acne. So with naturopathic medicine, we're often working in phases, starting with the gut, then the immune system, and finally hormones to address some of the root causes of acne. And it definitely doesn't look like a straightforward path. Sometimes people get worse before they get better because of the detox that we push. But in Tiffany's case, very excited to share that we had a really, really good experience along the way. And I think it was just 4 appointments across 2021.
Yeah. I would say 4 to 6 months, I was completely okay again.
That's incredible. And
Yeah.
how long did you struggle with acne before that?
Probably since I was 13, 14.
Yeah, you see a lot of it start with puberty.
Yes.
So
Mhm.
we'll also talk about hormonal causes.
Mhm.
I'll share a screen with some notes from your very first appointment, just so
Okay.
people can get an idea of what a treatment plan can look like. So we'll scroll down. Oftentimes we're making some recommendations on supplements and nutrients, which I send out to an online dispensary. You'll see some of these are food-based, and you can definitely do a lot of this through diet. So over here, it's either get this fiber or target 9 servings of vegetables a day. It's up to you what you do. Everyone's very different with how many supplements they're willing to take, how much lifestyle dietary change they're willing to make. So we do our best to customize it to the person. Yeah, and I think this is one of your more recent plans. I want to pull up one of the very first
Mhm.
ones that would be more helpful.
Yes. And then I was also on spiralactone before I saw you, and it worked really well. But after I got off it, that's when I saw that cystic acne.
Mm-hmm. Yeah, that's helpful to know the things you've tried before that, and I've noticed that myself, that sometimes the conventional treatments, they do work because they're getting to the etiology, but they're at some point our body kind of catches up and it stops working. And that's when you have to go a little bit deeper.
Yeah.
So great to hear that spironolactone was something that did work for you.
Mhm.
Okay. Let me see if I can pull up very first appointment notes. I know that I have quite a few tabs open here.
Yeah. And the first appointment, it was just so different from just a regular doctor. Like I think it was like 90 minutes of just
Mhm.
asking me about my health history, my bowel movements, stress levels, all that. So that was very amazing. It's more intuitive type of work.
Yes, that's so important to hear. So it's a very different type of doctor's appointment. We definitely get to take our time, and that's how we get to customize the plan.
Mhm.
So with naturopathic medical visits, it's a good idea to come prepared to talk about everything from childhood. It all can play a role. Sometimes people are exposed to different environmental triggers even in childhood. It could have been mold exposure in a home environment, or potentially an occupational exposure.
Yeah.
All of that is relevant. And I have it open. Okay, so this shows that our first phase for you was repair the gut. We took a detox perspective in your plan, supporting liver and gallbladder drainage. NAC is one of my favorite antioxidants to protect the liver. It can also open up things in the skin. So oftentimes, because you're detoxing, skin gets worse before it gets better.
Yes.
But this is very much all liver support. Even lecithin, it's a great food-based item to liquefy bile and start detoxing. And then we did a homeopathic that was specific to your case to also touch at if there was any stress or emotional aspect that we could shift or move.
Yeah.
We started with blood work to look at common nutrient deficiencies, and then we did a microbiome investigation. And we also talked through dietary recommendations. So, for example, gluten and dairy free has a lot of research on it for reducing acne. And I think you were someone who's already on board for that. You already knew about it, had tried it. So that part was easy to need to convince you there.
Yeah.
So we talked more about liver support and detox support.
Mhm.
And all of this work is actually really helpful even preconception. There's a lot you can do to detox to support egg quality,
Mhm.
because the egg that made you actually came from your grandmother. And so
Mhm.
when someone has a baby, babies are at the top of the food chain. They actually end up detoxing the mom, especially breastfeeding, for example. BPA and other types of environmental toxins, they can make their way out from the mom into the baby through that. So as much as we can clean up prior to conception, the more healthier, safer a pregnancy can be, and you're helping your baby's future hormones be balanced.
Yeah.
I think it's pretty cool that the baby sitting in the mom already has, if it's a female, has ovaries and eggs that's going to make the next generation. And that's how it's 3 generations there.
Would you say that's like epigenetics type of?
Yes, that's what we're doing is that
Yeah.
people are born with genes, but so much of it is environmental and how those genes are expressed. And that's
Yeah.
what we're finding with environmental toxins is they're turning on and turning off certain genes.
Mm.
When we address some nutrient deficiencies, you can help promote healthy expression of genes.
Yeah. That's so interesting. And you just don't hear about it that often.
Yeah, definitely. Nowadays, it's even more important because our load has increased quite a bit environmentally. And even water nowadays is carrying things like microplastics in it. And
Yeah.
so more and more people are dealing with acne. Acne is one of the more easier concerns, but there can even be more deeper concerns because of this type of toxin exposure. A lot of what I deal with in practice is endometriosis, and
Mhm.
there is some environmental component to it. Yes,
Do you think that's why we have more infertility nowadays in women?
absolutely. It plays a big role also on sperm quality.
Yeah.
Both men and women, it's fertility is definitely getting impacted. Electromagnetic frequency EMFs are also a bit of a culprit here. So got lots of things that are layering in our environment.
Yeah.
So I'm going to pull up your blood work results
Mhm.
next.
And then do you do these tests for everyone, or is it just different for each patient?
It's definitely customized to the patient.
Mhm.
But there are some tests that I do, if patient hasn't had it run by another doctor that year, I'll be
Mhm.
the one to order them. So once a year, I don't hesitate in checking someone's vitamin D levels, vitamin B12, iron levels, especially for females. I think they're really important. Doing a comprehensive thyroid workup.
Yeah.
So this is a metabolic panel that everybody has run once a year, and this was very healthy for you. Liver cells are looking healthy. Same with the lipid panel.
Mhm.
We did see some signs of nutrient deficiencies, specifically the vitamin D level. Your blood sugar balance was really great. This tells me you eat very well. It's not what you're eating.
But it's definitely more hormonal for me,
Yeah.
I think.
And the thyroid would flip back and forth for you because of Hashimoto's. Do you remember that discussion?
Yes. Mhm.
Yeah. So here we found some thyroid antibodies, just very slightly elevated. And some
Yeah.
people are able to bring this even down to zero
Mhm.
by working on detox pathways, the gut. So yes, there was some Hashimoto's causing this hyper to hypo fluctuation. Your iron levels look great. We just needed to put in more vitamin D. Iodine is another nutrient that I really like to test, and I don't see checked often for people because it is great for the thyroid. It's used to make thyroid hormone. It's also great at protecting you from hormone imbalances like too much estrogen. So it can prevent breast cysts and ovarian cysts.
Yeah. But when I was learning skincare, they're like, stay away from iodine. That's what causes acne. So I was probably eating less iodine stuff just to,
Okay, so that could be why it was on the lower end. We like it around 70. And iodine is something to be careful with.
Mhm.
That's why I check the level before prescribing it, because if someone takes too much iodine, it can make the Hashimoto's worse because it also revs up the immune system.
Mm.
So we do want to go low and slow with really clean
Yeah.
products,
Yeah.
and do as much through diet. But this is useful to know that you could use more iodine.
Yeah.
Okay, so this is how we start, and we follow up this with nourishing. So putting in any of the deficiencies. We already shared one of the example treatment plans.
Mhm.
And Tiffany had some more labs done. She also had a stool analysis. This is one of my favorite
It's
things
fun.
to run for people. Yes. And this also says that you eat very well. So it compares your microbiome to the average population,
Mhm.
gives you a score for how much bad bacteria growth there is.
Yeah.
And with this dysbiosis score of 2, is telling me that you do eat plenty of fiber. There was
Mhm.
just something very unique cultured in your gut, and that's this Citrobacter furendi complex. So not even something like candida or yeast. That's very common for you. It's specifically Citrobacter furendi. And the cool thing about this test is when something is cultured, they also show you how to treat it. So
Mhm.
here it gives us examples of natural agents as well as prescriptive agents that work against that overgrowth in the gut.
Yeah. It's nice to go over all this again, just like a refresher.
Yeah. So just walking through, another reason I like this test is because it's so thorough. So it
Mhm.
has bacteria that we've just started to get information on. There
Yeah.
isn't even much research on it, so we do have to customize it what the patient comes in as a concern. But it's great that no viruses, nothing pathogenic, no parasites, no protozoa, no worms, no flukes. None
Mhm.
of that was detected. Yeast was not detected for you.
Mhm.
Just a couple imbalance, which this beta strep is something we have to keep a close eye on also with pregnancy. They do check for it again. So having probiotics, keeping your immune system in good shape can prevent this from getting activated. In
Yeah.
pregnancy, if this is found present, then they do IV antibiotics. So that's why it's helpful to be stay on top of this one.
Yeah.
And for you, we started with just a couple of these antimicrobial agents. And this overlaps with what a lot of dermatologists do when they prescribe antibiotics. It's just more targeted, in which now we know exactly what we're trying to treat with the antimicrobials.
And then how about birth control? What do you think of that
Yeah, I
for
think,
hormones?
well, I believe in informed consent for birth control. So I have a questionnaire where I make sure the person is aware of all the possible side effects. There's definitely a place for it. Not everyone has the time where
Mhm.
they are to do a lot of these lifestyle changes. And then sometimes when there are concerns like endometriosis, they just kind of want to put a lid on it until they want to deal with fertility later. So it depends on where you are. I
Mhm.
think birth control has a role, but we do have to talk about family history of things like stroke to help decide which type of birth control. Can we go with something low dose? Um, and then sometimes I still check hormones, even if a person's on birth control, because I've had patients who've come in on birth control and it hasn't done enough. They actually still have estrogen spikes.
Yeah.
So birth control for skin, it can help because it stops those hormone fluctuations. You have to know that you're not ovulating, and so you're missing the estrogen surges, which that can be okay in your 20s. If you're a teenager on it, it can impact bone density down the road not to have those hormone surges.
Wow.
So it's definitely a risk benefit discussion.
Yeah.
And if you're in the middle of a school year, just don't have time to make these lifestyle changes, and sure, put in birth control and revisit it over the summer when you have time to make changes.
Yeah. So it's just more about balance.
Yes,
And
and if someone's on birth control, then it's especially a reason to support their liver with that plan I gave you in the first phase,
yeah.
because long-term birth control, there is an increased risk of things like gallstones, liver cysts. So the more we can do to help the liver with B vitamins, magnesium, probiotics, these are common things that are depleted on birth control, the better a person's going to tolerate birth control and being able to take it and minimizing the side effects.
Yeah. And then if someone wants to get pregnant, when do you suggest, getting off birth control?
I do want to give at least 3 months after birth control to be able to cleanse and reset. So I wouldn't recommend getting pregnant right away
Yeah.
unless it was part of an IVF protocol regimen.
Mm. And then I have a few clients that got off birth control and then their skin just
Mhm.
purges. How long does that usually last for them? Or is it they have to balance hormones too?
Great question. So there is something called post-birth control syndrome.
Yeah.
There's a book by Dr. Jolene Brighton that can be helpful for that. So they might be having post-birth control syndrome. It's helpful to find out why they'd started birth control. Was it to mask heavy periods or acne? Because if so, then when you remove it, you're going to see that worse
Hmm.
um, for some time. And so especially getting to the cause. So then now let's address the liver, support your hormones if you're getting ready to conceive soon. That's very helpful.
Yeah.
Does that answer the question? So acne after birth control, it is possible. Part of it is because of birth control, but another part of it is because you've removed the stopper and you're going to see the underlying health.
Yeah. Because that did happen for me. And then I think it took about a year for my skin to balance out.
Mhm.
But yeah, I think it's just important for girls to know that they have to balance hormones and nourish their insides first too.
Absolutely. And you got better in see a total, you were feeling better even at your third appointment in.
Hmm.
But I do want to share one of my favorite hormone tests
Hmm.
for those who want to dive deeper. And I know or you won't you it's not something that's a good fit for you now, but in the future, it's something to think about if you're looking to go above and beyond and finding out how
Yeah.
your hormones are balanced. And the reason it's not a good fit for you now is because you are happily pregnant.
Yes.
Wonderful. So this is my favorite hormone test. This is just a sample report.
Hmm.
It's done after ovulation because that is when you'll see progesterone peak. So this one's done about day 19. For people who don't know when they ovulate or have irregular cycles, it's possible to do a version of this test that's collected every day for a month. So you can map your hormones across the month too. And it gives us a balance of estrogen to progesterone, testosterone. It also shows us how a person handles stress with checking cortisol. So we get to see if someone's burnt out or if they're spiking, how they convert cortisol. And see, my favorite part is this estrogen metabolism. I think that's really unique. So this red pathway, we can lower this with supplements. It's normal for this sample report. For some people, if it's high, it can contribute to DNA damage. So those different types of breast cancers. So you can address that risk by reducing this pathway, by supporting the liver. I think that's very unique. And it also looks at a few vitamins. This is the adrenals in more detail, your storage form of cortisone. So it answers that question about burnout. Here is that information about nutrients, B12, B6, glutathione, gut inflammation, melatonin, and exposure to pollution with oxidative stress checked. Yeah. And
we do that after I give birth.
yeah, I think it's nice to have to know, okay, at this time in my life, this is what my hormones look like.
Yeah.
And because it is something you can use long term. I want to share the photos you provided me. So this is the skin prior to treatment.
Yep, that was before, that was after spirolactone.
Yeah. So after spironolactone helped a little bit, but didn't kind of give the full picture. So this is a good comparison of before and after as well.
Yeah, because I didn't want to be on it for too long. So I just stopped it, but maybe I stopped it too abruptly and then it could happen.
A little bit of a flare. It's possible to taper spironolactone. But for you, you got better without us even suppressing testosterone. So spironolactone helps if testosterone's a culprit.
Yeah.
And for you, the testosterone issues, if any, were because of possibly nutrient deficiencies like vitamin D being too low. It's up there and it impacts the rest.
Yeah. And then what do you think about like eczema and rosacea? Do people be born with that, or it's just over time environmental factors?
Eczema especially, it's related to detox through the skin. We see a lot of kids these days with eczema, a lot of food sensitivities and allergies. That can be because the gut lining is weakened because of pesticides in food. So eating organic food can definitely lower pesticide exposure and help heal up that leaky gut and reduce eczema on the skin. So it's a fine line. We heal, but then I also push a little bit of detox through the skin in small quantities. And so depending on how severe the eczema is, sometimes it's quick. You can do a Dead Sea salt bath, which replenishes your minerals and things get better. Other times we detox slowly across months, treat what's in the microbiome, and things get better across 1 to 2 years. But generally 1 to 2 years max, people are happy with their results.
Nice. And then I remember us talking about fasting too and women's hormones. How does that affect it? Because I was fasting. I could fast for like 4 hours. And that made a huge difference once I started eating breakfast. Yeah.
So fasting, I think, works really well for men. With women, we have to be careful, especially in the second half of our cycle when we need that progesterone spike, because fasting can cause cortisol, the stress hormone, to come up and steal from progesterone and then mess up your upcoming period. It can cause more pain in that period. So your insulin sensitivity is down after ovulation in the second half of the cycle. So you do want to eat protein and plant-based fat. So I actually do reverse fasting. I want people to skip dinner if they're going to fast, not necessarily breakfast. Breakfast, I think, is very important for women. Some people with poor sleep also need protein before going to bed. But generally, if you're trying to fast, I would rather someone starts with skipping dinner. And for women, start with your follicular phase, not your luteal phase. Take it low and slow. You can really throw off your hormones if you go too quick into the longer fasts.
Yeah, I felt like that made the biggest difference. Just having small breakfast in the morning, it just helps with your moods throughout the day.
Absolutely. It can really set the tone for the day to come. So
Mhm.
what it represents is you're saying, I choose myself before I choose everything else. I think too often we start with, okay, what do we need to do? How can we help other people? But taking
Right.
that time to say, no, me first, I
Yeah.
need to eat first, it sets you up to have a really successful day,
Yeah.
hormone wise, blood
Yeah.
sugar wise. Yeah. And then long term, that's a way to balance out your hormones. A way to lower testosterone spikes is to balance that blood sugar.
Mhm. And then you did help me with pregnancy. So how did we prepare for that?
It's a great point. I do like having that time before someone starts trying to conceive, because we're seeing more and more what a role the microbiome can play. And we talk about detox, but working through the gut, the biofilms in the gut,
Mhm.
that itself can release things like heavy metals and toxins. So we started with the gut. We put in nutrients, we detox the gut, detox the liver, and that created a really successful, healthy space for this new life to enter into.
Mhm.
Um, so I think preconception care is really important for both mom and dad. And oftentimes I'm having men check sperm quality
Yeah.
because it's just as important. We want the optimal sperm to meet the optimal egg.
Mhm. Exactly. Mhm.
All
Okay.
right. I know this Zoom meeting is about, the timer is
So
almost
fast.
on. Yeah, but anything else? Any other questions for me?
There was one question. Is it important to go gluten-free and dairy-free if you have endometriosis?
Great question. Yes. So, dairy free, I do recommend that for patients, especially in the United States, because a lot of our dairy has external sources of hormones. And endometriosis is known to be because of too much estrogen around, not enough progesterone. So yes, in the US, but studies are showing that dairy is fine for those with endometriosis, possibly because it has a lot of vitamin D in it.
Yeah.
So it's going to be person to person. If you have a lot of endometriosis pain, the best thing you can do is go right into a 6 weeks of gluten-free. There is a study on that saying that lowers pain. So potentially you don't need to see me or do deeper work. If you've just done 6 weeks of gluten-free, your
Mhm.
pain could be down just by doing that.
Yeah.
And yeah, unfortunately, it's food quality here that's playing a role in the issue. Our grains are genetically modified to have more and more gluten, which means more and more pesticides. And so people are often allergic to these two things in the US, but able to enjoy them in foreign countries that have restricted our importing our food. Europe has a lot of bans on American
Mm.
wheat specifically.
Yes. Well, that was really great. I'm glad that we were able to just have an open conversation about my health history and just to share with my clients my journey with my skin too.
I think what you do is so amazing. I'm definitely going to come see you myself, but the fact that you put it together for people outside and inside, I think that's really powerful. So we're in it together.
Yeah.
And natural medicine is really powerful here. So looking forward to helping people feel better with you.
Yes. Thank you so much. Where can they find you?
Great question. My website is dr-sony.com, dr-sony.com. I'm in San Jose. So look me up or give me a call. I'm also on Instagram as at the endo doc. There's a period between the endo and doc.
Mhm.
And what's your Instagram handle?
Mine is Motif Aesthetics. So Motiff Aesthetics. So thank you, Dr. Soni, for doing this with me. It was really great and very informative. Yeah,
My pleasure. Thank you for being so open.
thank you.
Bye.
Bye.
I think it's stopped. Let's see here.